All right. Good morning, Dr. Rawlins.
Good
Thank you so
morning.
much for joining me for EMS week this week, because this is coming out during EMS week. I'd like for you to introduce yourself. If you could explain your name, your credentials, and kind of why you're here.
Yeah, my name is Dr. Knolan Rawlins. I am an assistant professor at Delaware State University. I hold a doctorate in education with a special focus on kinesiology and public and allied health programs.
Awesome. And it was Delaware State University that Savvik Foundation went to, looking for a study to be done on EMS, specifically diversity and inclusion in EMS. And you spearheaded that project. So I'd love to hear about what those early conversations with the Savvik Foundation board sounded like, kind of where things went from the beginning into building out the project.
So how it happened was once Savvik got in contact with Delaware State University, there was a small group of statisticians and um, some public health folks that were trying to understand the ask. And the initial ask was, how do we understand these unconscious bias? Because Savvik wanted to access groups of people for workforce development that were untouched. And it was how I got involved is that one of the statisticians that they were in contact with after the call, he came over into my office and was like, they want me to measure unconscious bias. I don't know what that is. So I was like, well, he's a researcher. And I was like, well, in your study, you can define it however you want. In my world, we call that operationally defining. So I said I would operationally define it as differences in opinions. And for that, you need to ask a large number of people what they think's going on. And agreement's interesting. However, the disagreement is really the secret sauce.
Right, exactly. I remember reading through the results of the study and seeing just kind of some of the conclusions that were drawn is that we're just not all on the same page. But how do you
Right.
go from the idea that you've got this unconscious, unknown bias, and you kind of build out this methodology that gives you the result of we have differences of opinion? Can you explain kind of the process of building that?
Yeah, it's kind of a framework of thought, and this kind of came with my work with diversity in aquatics, and it's another realm where there's a group of uh, white people that are doing very well in the aquatics world, and then there's disparities in drowning, and I didn't understand that. In fact, when I came to DSU, I wanted to do a gym and swim program and build community partnerships, and when I asked um, is the pool available? I got laughed at because they're like, that's not a big thing in our culture. And even though I work in an HBCU, I was not born into the intended population. There are some commonalities I have being a first generation to go to uh, college. In my family, I had that in common. I had a teaching focus, which is really prominent in HBCUs, but I didn't really understand the culture. So me and a group of colleagues, what we did is we just started asking questions. And that's kind of how it started with the Savvik. So it worked out really well that I don't have a background in EMS services at all. But I have a framework for asking questions and kind of cultivating these discussions. And it's the discussions that are important. Like I said, disagreement is really key when you're trying to tap into a community that you're not part of. So I lead with I'm going to see this different than you, but I want to hear those differences, and then let's see if that's a bigger theme. Um,
Right. So
so
so when you built the questions out, you were specifically looking for things that were maybe a little bit more polarizing of things.
yeah, absolutely. So and what we started was with focus groups. So my team we identified a, a point of contact in every state, all the 50 states, and we did that just by Googling EMS services interstate. And we ended up with 72 contacts that we just started, asking them to attend focus groups. And we just started taking notes, and some themes emerged. Disparities in education emerged, was a big one. I now know that the field training officer is one of the most important people in the company. Um, and then there are barriers or perceived barriers with that training, and across, the country, there's different processes. So that was the starting point. And then through these conversations, we started, getting more specific with our questions. And then we came up with statements. And then we asked people across the country, do they agree with these statements? And that's kind of how we started gathering information.
So as you were kind of going through doing the big survey, we
Yeah.
had it at our booth at EMS World,
Yes.
and we pushed it out on our social medias. I remember doing the marketing push for it. How many people actually gave in answers to that big survey that we pushed out to just the general industry?
So we had 753 participants, I believe. Um, so it was amazing. We got a big start at EMS World, where people walking by, we pulled them, and we managed to get the survey down to about 5 minutes to completion. And then in addition to getting the direct contact with the people that were walking through EMS World, we also started collecting business cards of educators, of field training officers, of these types of people that are in leadership position, and they helped facilitate the study and get our survey out.
Awesome. I remember taking the survey myself because I was a person who was in EMS and I have an opinion on these things. And I remember thinking about how specifically crafted a lot of the questions were. I know a lot of dissent when it comes to DEI studies in general is, how do you know that you're not biased? How do you know that you're
Yeah.
not coming out here and trying to make it not confrontational when the result is, showing the reasons for the disparity, but kind of showing it as more of a difference of opinion. And I think that this study did that so well.
Thank you.
Were there any considerations for internal biases, for trying to be a little bit more oriented on the thought processes and not kind of on the blame game? Can you explain to me how the
Oh,
talk to the haters,
oh, yeah,
basically?
yeah. So what a lot of the diversity conversation pushes out one group to promote another. And I lean into that. So a lot of the questions were about perception. So what is your story? And it was you bring up a good point, because there was pushback at the EMS World when they heard, we're asking questions about ethnicity. A lot of folks that identify as white were like, well, you don't want my opinion. And that couldn't be further from the truth. Um, so diversity, equity, and inclusion, we mess up the eyepiece. We mess up the eyepiece because inclusion means everybody. And we're changing that framework of thinking. So it's less about diversity, equity, and inclusion. And I got another acronym for you, CAP. So it's about connecting, accepting, and then providing. So when we talked about this study, we first connected with groups of people. And we wanted you to identify who you were. Um, you and I are both white, but that doesn't mean we agree on everything.
Right.
Um, gender comes into play on how we experience our lives day to day. So I ask people to embrace that. So Christina, as a white woman, what are you seeing? And part of the story that kind of was teased out was, in the EMS space, when we talked about minority groups, we need to include women. So, when we talk Black, Indigenous, people of color, those are important and those are underrepresented. However, by including, people of all ethnicities, I learned that women are underrepresented, and it was really, really interesting. We had a couple of people that identified as Black women, one from Louisiana, one from Delaware, and they both said it's harder being a woman than a person of color in this space.
Wow, that's a really powerful sentiment, and it's a really, I guess, not a broad scope, but it's the inclusive scope that we're looking
Yeah.
for when it comes to things like, asking these hard questions. Um, as far as reading through the results, when you started pulling together all of the data from this 700 plus person multi-month, meticulously crafted study, what did we find? What were the findings from the study itself?
Yeah, so the there were it was thematic. I hit on the big one that it's interesting that you have these focus groups and then these are sentiments like we just talked about. It was interesting once we got the data back that the sentiments were echoed. It wasn't a one-off. It was thematic and it was very easy to track. So the underrepresentation of women. We also talked about welcoming factor. So the groups that are not being retained, it's because they don't feel welcomed. And now we got to the A part, so we connected. Now we got to accept, and it doesn't mean somebody was doing a poor job and intentionally being racist. That's not what the accept piece means. The accept piece means we need to learn a little bit more about why people didn't feel included. And one of the biggest things is lack of representation in leadership positions. Wherever I do kind of this research, whether it be in the realm of aquatics or EMS services, people need to see somebody they identify as, and not just an entry-level position. We found that mentorship was another theme. It was especially prominent in the groups that are historically underrepresented in this space. And two contrasting things. 91% of all participants across the board agreed that a mentorship program was important. That was the item that was agreed on more than anything else. And the contrast to that, only 49%, and that was our lowest level of agreement, said that there was a comprehensive mentorship program at their agency. And this was across all kinds of agencies, because I thought there'd only be a couple when we categorized agencies. I couldn't be more wrong.
EMS is pretty diverse. There's a lot going on.
Private, public. I was like, I got it. And they're like, no, it's kind of private, but it's funded by, oh my word.
And there's hospitals and you've got volley services and you've got services attached to fire. Yeah, there's a lot going on.
I didn't know what I didn't know.
But now knowing what you do, and looking kind of at the broader sense of EMS as a whole, what do the findings point to as far as the future? When we're talking through EMS week, we're talking about looking at the past, and EMS historically has been a white dominated field. It's been a historically male dominated field. But looking at your study and in the context of what we're seeing there, what are actionable steps for people in leadership positions that are in ambulance organizations or in rescue centers that are looking kind of at, increasing their workforce and hiring more diverse staff? What are their kind of actionable items that we're seeing from this data?
Well, first off, it's going to start with the recruitment, going into areas that you've never thought of before and trying to recruit. And then once they are recruited, you need to have onboarding that's culturally competent. And then beyond that, the next stage is, how do you bring these people that weren't traditionally in EMS, how do you show them a career path? That's really what's missing, is them seeing themselves on a career path and not a job.
I'm glad you mentioned cultural competence, because I think there's an education moment here, because there's a lot of things I didn't know, for instance, about swimming, how swimming is kind of,
right.
It's not built for culturally, for minorities. Generally, it's not like, I grew up in Florida, there's pools everywhere, but still, even
Gotcha.
here, you have problems with like underrepresented populations when it comes to things like swimming and diving and, basically pool culture, because it's just not, we have the same barrier here, even though it's everywhere. So when we talk about cultural competence, when we're talking about onboarding and training programs, can you give some examples of what that looks like?
Yeah, it really looks like open conversations. And then really they need to see a couple of things. They need to see an objective path up the career ladder. And they need to see individuals that they identify with along that path. Those are the two biggest things. And we have a grant program where we help agencies develop that. So that's the next phase. So that's the provide. So we've done the connection, which people tend to stay in connection. In my opinion, that's what's wrong with the DEI model, is there's a lot of talk about. There's no actionable steps. So now that we've connected with wide range of populations. We know what we need to do. We kind of did before, but now we have data, so it is actionable. Oh, and then now we're accepting, okay, you and I have different perspectives. It doesn't mean I'm bad, you're good, or vice versa. We need to lean in. We talk about bias a lot. It's there. It's there. And I think we've tried to curb people's life history and not respected their stories. So that's why telling one group to get out to make room for the other is silly. And it's especially silly in this place where we have shortages. So it's it turns away from just being the right thing to do to being a necessary thing to survive.
Absolutely. I know there's a huge problem with staffing right now in EMS in general, and it's happening everywhere. But part of that could be alleviated by, having a more diverse recruitment structure that integrates populations that maybe weren't as represented in EMS before.
Mhm.
So I think there's that side of it, but there's also patient outcomes. Patient outcomes are
Oh,
generally better when you
yeah.
have somebody who's culturally closer to your patient. I specifically remember there was a patient I had once who would he said he had the blood. And my partner, who was a Black man, said, "Oh, he has sickle cell." I did not realize that. And there's a lot that we don't know about sickle cell in the healthcare community just because it's not as taught. It's a disease that mostly affects people of color. It's generally not something that you go into very much. I have nursing friends who have said the exact same sentiment where this is an outcome that I didn't understand until I had a friend who was of color explain this to me. It's not as big in our community. So I think not only for the benefits of just workforce, getting bodies in the trucks, I mean getting people who are culturally closer to your service demographic is going to be great for patient outcomes. But in the long and short of the whole study, if you had a message, if you could just look through the screen and talk to leaders at ambulance organizations, what would you say to them when it comes to diversity, inclusion, kind of the whole project? What would you say directly if you could talk through the screen to them?
So there's two things. One is sustainability. So this because again, this isn't just it's the right thing to do, patient outcomes. Uh, we're in trouble. We have a dwindling workforce and we need innovative solutions. And then the second thing is accept that your agency may or may not be doing great in this space. And it doesn't mean that you're bad. It's not a judgment piece. It's a learning opportunity. So if we think about sustainability and we think about a learner mindset, uh, we have an opportunity to kind of change the field because it evolve or die. That's where we're at.
Evolve or die. I mean, grave words, but we see it all the time where ambulance organizations are closing their doors. There's a lack of staffing. There's, organizations running in 45-minute response times, and nobody deserves that.
It's tough. It's
It's
tough.
it's it's a tough world out there, and the people in EMS are tougher. But thank you so much, Dr. Rawlins, for your time, for your research. I will have a link in the description of this video for the published article that gives the results of the study. And if you have any questions, there will also be a link to the study platform on the Savvik website. You can send us over an email. We will send it to Dr. Rawlins if we can't answer it ourselves.
Sounds great.
And